I want to talk to you today about something that many people never think about, and that's genuinely worth understanding for a great many older adults: the ways your heart health and risks are connected to the night, to sleep, and to what happens while you rest. Because most people think of heart risk as something to do with daytime activity, exertion, and stress, and don't realize that the night, your sleep, and what happens during it plays an important and underappreciated role in heart health. So today I want to explain the connection between sleep, the night, and your heart. The things that happen at night that matter for your heart, including poor sleep, sleep apnea, and the timing of certain events. Why these are so often overlooked, and what you can do to protect your heart through good sleep and attention to the night. And I'll keep this calm and practical, because while these nighttime factors are genuinely important and underappreciated, understanding them lets you protect your heart in ways many people miss, through good sleep, attention to sleep problems, and your doctor's care. And as always, this is about understanding and partnering with your doctor, not self-diagnosing or alarm. Let me start with the connection between sleep itself and heart health, because it's more important than most people realize. Sleep is not just rest. It's a time when your body, including your heart and circulation, recovers and regulates itself. So good, sufficient. Quality sleep genuinely supports heart health, while poor sleep, too little sleep, or poor quality sleep over time, is associated with higher blood pressure and increased risk of heart and cardiovascular problems. As I've discussed elsewhere, sleep often becomes more fragmented and challenging with age. So many older adults aren't sleeping well, and this matters for the heart, not just for daytime tiredness. The connection works partly because, normally, blood pressure dips during sleep. Giving the heart and circulation a rest, and disrupted sleep can interfere with this beneficial dip and with the body's regulation. So the first key understanding is that sleep itself matters for your heart. Good, sufficient sleep supports heart health, while chronic poor sleep is associated with higher blood pressure and heart risk, making the quality and quantity of your sleep an underappreciated part of heart health. So protecting your heart includes protecting your sleep, which many people never connect. So good sleep is an underappreciated heart protector. So sleep quality is the first key. Let me give you the most important specific nighttime heart factor, the one most worth knowing about: sleep apnea. Sleep apnea is a condition, common and often undiagnosed in older adults, where breathing repeatedly stops and starts during sleep, often with loud snoring, gasping or choking, and pauses in breathing that someone may notice, leaving the person unrefreshed and sleepy in the day, despite a full night in bed. Here's why it matters so much for the heart. These repeated breathing pauses stress the body and the heart through the night, with drops in oxygen and surges that strain the cardiovascular system. And sleep apnea is genuinely associated with high blood pressure, heart problems, irregular heart rhythms like the atrial fibrillation I've discussed, and increased cardiovascular risk. So sleep apnea is an important, common, and often missed nighttime condition that genuinely affects the heart. And crucially, it's treatable. So identifying and treating it can both improve sleep and reduce the cardiovascular strain. This is exactly why it's so worth knowing about. It's common, it harms the heart, it's often undiagnosed because it happens during sleep, and treating it helps. So the key specific nighttime factor is sleep apnea, a common, often missed treatable condition that stresses the heart, well worth recognizing and addressing. So sleep apnea is the central nighttime heart risk to know. Let me describe the signs of sleep apnea, because recognizing them is what gets it identified and treated. Because sleep apnea happens during sleep, the person often doesn't know they have it, so the signs are important to know, and a bed partner often notices them. The signs include loud, habitual snoring, pauses in breathing during sleep, or gasping or choking, often noticed by a partner, waking unrefreshed despite a full night's sleep, excessive daytime sleepiness or fatigue, morning headaches, waking frequently or with a dry mouth as I've discussed, difficulty concentrating, and, relevantly, poorly controlled blood pressure. So if you snore loudly and habitually, if anyone has noticed you stop breathing, gasp or choke during sleep, if you wake unrefreshed and are very sleepy in the day, or if you have these other signs, especially with high blood pressure, sleep apnea is worth considering and mentioning to your doctor. Recognizing these signs, often with a partner's help, is what leads to getting sleep apnea diagnosed and treated, which benefits both sleep and heart. So the signs of sleep apnea: loud snoring, noticed breathing pauses or gasping, unrefreshing sleep, daytime sleepiness and poorly controlled blood pressure are worth recognizing and mentioning to your doctor, because identifying and treating sleep apnea protects the heart. So knowing the signs gets sleep apnea treated. Let me address the timing of heart events and other nighttime and morning factors, because there are a few more pieces worth understanding, handled carefully. There are some recognized patterns around the timing of heart events. For instance, the early morning hours, around waking, are a time when heart attacks and strokes are somewhat more likely, thought to relate to the body's natural rhythms, and the surge in blood pressure and heart activity on waking. And some nighttime symptoms matter too. A couple of practical points follow. First, certain heart symptoms at night are worth heeding. Breathlessness that comes on when lying flat or that wakes you at night needing to prop yourself up to breathe can be a sign of heart failure, as I've discussed, and is worth mentioning to your doctor. And nighttime chest pain or other heart attack symptoms, as always, need emergency attention. Second, the morning blood pressure surge and the timing of events are reasons some doctors consider the timing of blood pressure medications, which is a matter for your doctor, not for you to adjust on your own. I want to be balanced and not alarming here. The point isn't to fear the night, but to know that the night and early morning have some relevance to heart health, that certain nighttime symptoms are worth heeding, and that these are matters to discuss with your doctor. So the timing of heart events and certain nighttime symptoms, like lying flat or nighttime breathlessness, are worth understanding and mentioning to your doctor, without fearing the night. So nighttime symptoms and timing are worth knowing. Calmly, let me explain why all this matters, because the nighttime dimension of heart health is both real and actionable. It matters because, as I've explained, sleep and the night genuinely affect the heart. Poor sleep is associated with higher blood pressure and heart risk. Sleep apnea, common and often missed, stresses the heart and raises cardiovascular risk, but is treatable. And certain nighttime symptoms can signal heart problems like heart failure. So attending to the nighttime dimension, by protecting your sleep, identifying and treating sleep apnea, and heeding nighttime symptoms, lets you protect your heart in ways that are often overlooked, capturing benefits and catching problems that daytime-focused thinking misses. Treating sleep apnea in particular can meaningfully improve both sleep and heart health. So the nighttime dimension matters because it genuinely affects the heart and offers real, often missed opportunities to protect it through good sleep, addressing sleep apnea, and heeding nighttime symptoms, all with your doctor. This is exactly why understanding the night-heart connection, which many people never consider, is worthwhile. So the real actionable nighttime dimension makes it worth understanding. So attending to the night protects the heart. Let me give you the practical things you can do, because there's a great deal within reach. First, protect your sleep, since good sleep supports heart health. Prioritize getting sufficient, good quality sleep, with the healthy sleep habits I've discussed. A regular schedule, a comfortable, cool, dark, quiet bedroom, limiting caffeine and alcohol, especially later in the day, getting daylight and activity, and a wind-down routine, and address sleep problems rather than just accepting poor sleep. Second, and importantly, recognize and address possible sleep apnea. If you have the signs, loud snoring, noticed breathing pauses or gasping, unrefreshing sleep, daytime sleepiness, especially with high blood pressure, mention them to your doctor, who can arrange assessment, and if it's sleep apnea, treatment, which genuinely helps both sleep and heart. Third, heed nighttime heart symptoms. Mention to your doctor breathlessness when lying flat or that wakes you at night, and treat a nighttime chest pain or heart attack symptoms as the emergency they are. Fourth, take your heart medications as prescribed and discuss their timing with your doctor if relevant, never adjusting it on your own. And fifth, protect your heart through all the established daytime measures too, since the night complements rather than replaces them. So protecting your sleep, recognizing and addressing sleep apnea, heeding nighttime heart symptoms, managing medications with your doctor, and the established heart measures together let you protect your heart by day and night. So good sleep, addressing sleep apnea, and heeding night symptoms are the practical keys. Let me paint you a picture of how this understanding helps. Picture a man in his 70s who snores loudly, often wakes gasping, sleeps poorly, and is exhausted in the day despite a full night in bed, and has high blood pressure that's hard to control, but who, like most people, never connects any of this to his heart, thinking heart risk is about daytime exertion. In the unaware version, his undiagnosed sleep apnea silently stresses his heart night after night, contributing to his stubborn blood pressure and raising his cardiovascular risk, all overlooked. Now picture him understanding the night-heart connection. He or his partner, who notices the snoring and breathing pauses, recognizes the signs of possible sleep apnea, and he mentions them to his doctor, who arranges assessment, diagnoses sleep apnea, and treats it, which improves his sleep, his daytime energy, his blood pressure, and reduces the strain on his heart. He also improves his sleep habits and attends to his heart by day. By recognizing and addressing the nighttime dimension, especially the sleep apnea, he protects his heart in a way he'd otherwise have missed entirely. The same man, but understanding that the night matters for his heart, caught and treated a hidden, heart-stressing condition. That contrast is exactly why the underappreciated night-heart connection is worth understanding. So recognizing and treating the nighttime factor protected his heart. And let me speak directly to those of you caring for or close to an older person, because the nighttime heart connection is overlooked and you, especially a bed partner, may be best placed to notice key signs. Understand that sleep and the night genuinely affect heart health. Poor sleep is linked to higher blood pressure and heart risk. And sleep apnea, common and often undiagnosed, stresses the heart but is treatable. Crucially, you may notice the signs of sleep apnea that the person themselves can't. Loud, habitual snoring, pauses in breathing, gasping or choking during sleep, alongside unrefreshing sleep, daytime sleepiness, and hard to control blood pressure. So if you notice these, encourage them to mention it to their doctor for assessment, since treating sleep apnea helps both sleep and heart. You can support good sleep habits and encourage heeding nighttime heart symptoms like breathlessness lying flat or that wakes them, while treating nighttime chest pain as an emergency, support their heart medications as prescribed, and their daytime heart care. Helping a loved one recognize and address the nighttime dimension of heart health, especially by noticing and acting on signs of sleep apnea, can protect their heart in a way easily missed. So your noticing and supporting action on nighttime factors genuinely helps protect their heart. Let me draw this all together. The connection between the night, sleep, and heart health is real and underappreciated. Since most people think of heart risk as a daytime matter, sleep itself matters. Good, sufficient sleep supports heart health, while chronic poor sleep is associated with higher blood pressure and heart risk, and blood pressure normally dips during sleep, a benefit that disrupted sleep interferes with. The most important specific nighttime factor is sleep apnea, common and often undiagnosed in older adults where breathing repeatedly stops during sleep, stressing the heart and raising cardiovascular risk, including high blood pressure and irregular rhythms, but which is treatable. So recognizing its signs, loud snoring, noticed breathing pauses or gasping, unrefreshing sleep, daytime sleepiness, and hard to control blood pressure, and getting it assessed and treated protects both sleep and heart. Certain nighttime symptoms like breathlessness lying flat or that wakes you are worth heeding as possible heart signs, and the timing of heart events and medications is a matter for your doctor, all without fearing the night. This matters because the nighttime dimension genuinely affects the heart and offers real, often missed opportunities to protect it. So protect your sleep, recognize and address sleep apnea, heed nighttime heart symptoms, manage medications with your doctor, and keep up the established daytime heart measures. So here's what I'll leave you with. First, understand that sleep and the night genuinely matter for your heart, since good, sufficient sleep supports heart health, while chronic poor sleep is associated with higher blood pressure and heart risk. So protecting your heart includes protecting your sleep, something many people never connect. Second, and most importantly, know about sleep apnea, a common, often undiagnosed condition where breathing repeatedly stops during sleep, stressing the heart and raising cardiovascular risk, and recognize its signs: loud habitual snoring, pauses in breathing or gasping noticed by a partner, waking unrefreshed, daytime sleepiness, and hard to control blood pressure, and mention them to your doctor, since treating sleep apnea helps both sleep and heart. Third, Heed nighttime heart symptoms, mentioning to your doctor breathlessness when lying flat or that wakes you at night, which can signal heart failure, and treating nighttime chest pain or heart attack symptoms as the emergency they are. Fourth, protect your sleep with healthy sleep habits, and by addressing sleep problems, take your heart medications as prescribed, discussing their timing with your doctor if relevant without adjusting it yourself, and keep up the established daytime heart measures. And fifth, hold this calmly. The point isn't to fear the night, but to understand that it matters for your heart and offers real, often missed ways to protect it through good sleep, addressing sleep apnea, and heeding nighttime symptoms, all with your doctor. The nighttime dimension of heart health is genuinely important and easily overlooked, so understanding it lets you protect your heart in ways many people miss. So take care of yourself, protect your sleep, get possible sleep apnea checked, heed nighttime symptoms, and care for your heart by day and night. And because diagnosing and treating sleep apnea and heart conditions require a doctor, please treat the signs of sleep apnea and concerning nighttime symptoms as your reason to see your own physician, who can assess and help rather than as a substitute for that care, and treat nighttime heart attack symptoms as an emergency.